morning.
Good morning, Dr. Surya. Can you hear us? Can you see us?
Yeah, very well.
Okay, wonderful. Are we ready to begin this interaction?
Yeah, are you ready with questions?
Yes, I'm ready with the questions. May I request you to please introduce the panel over there?
I have Professor Vasti here. First, let me welcome all the delegates. I'm sorry I'm not there to welcome you, but I'm here to welcome you right from Dubai, Abu Dhabi. So I have Professor Vasti with me. Professor Vasti is a senior most physiatrist and chairman of the conference. He's going to welcome all the panelists as a conference chairman. Good morning, Mumbai. You will have to talk for this.
Of the specialist. When I started my job 20 years ago, this kind of medicine was an elite medicine for few people. Now are a lot of doctors that improved their competence in this field, and not only doctors but a lot of specialists like OT, PT, and so on. And this is, for me, in the last years, been a good development for our specialties.
So at that point, I will just summarize for the panelists on my right. They have said, Professor Falker said, plasticity and understanding of plasticity is a very important advance. Professor Wilson said that the goal-directed and aimed rehabilitation is a very significant advance. And Dr. Lofredo said that the competency development of the physicians and the occupational therapists and physical therapists and speech therapists is a very significant advance. Now I move to my left and I will go to Professor Stephen Clark on the same question, please. What's the key development in your opinion?
First of all, good morning, everybody. In addition to the points which were mentioned, I believe it would be very important to mention also the contribution of studies on efficacy, of effectiveness of our interventions. The randomized control studies of high quality have been published in the last decade, and meta-analysis help us to reaffirm the predominant role of neurorehabilitation for the recovery of our patients.
Same to you, Professor Lee.
Okay, I think the important thing is the advancement in technology in the last 20 years that actually helping us to get better understanding how rehabilitation can help the neurological patients. Because when I started practicing in rehab, at the time we just practicing rehab without knowing why it really helps. And at the time, it's still in the early age, we didn't have definite evidence-based type of practice. But with the advance of neuroimaging and with better understanding, as what Professor Walker said, we better understand how the neuroplasticity work through neuroplasticity. And now we have developed many new techniques. No matter whether it's high technology or low technology, we can help the patient. That's why no matter whether we are working in the high-income countries or low-income countries, we have different methods to help our neurological patients to achieve better functional outcome.
Thank you, Professor Tate.
Hello, everybody. I'd like to follow up Professor Clark's comment. One of the major advances in the last decades that I believe is coming to terms with the knowledge explosion that we have. There is so much literature being published on efficacy studies, and there are various groups around the world who are compiling that information to make it very accessible for researchers and clinicians. And there's a range of databases, particularly for allied health. A database that I'm involved in is PsychBite, and so, for example, it looks at neuropsychological rehabilitation. We have something like 4,500 trials on it, more than 600 systematic reviews, and these primary studies are rated for their methodological strength. So it's one way that it makes it very easy for researchers and clinicians to quickly access the best literature that's going to be giving us information about how we should be treating our patients.
So, from the panelists from my left, the summary is that Professor Clark and Professor Tate has indicated the evidence-based practice, and the more evidence coming and sharing of that evidence is most important in the key development in advancing our knowledge and advancing our practice in neurorehabilitation. And Professor Lee has said that the new development in technology, particularly the imaging, and being able to provide evidence that what we do works through clinical investigation is a specifically very important development. I will just add to that these are all very important developments, and what has also really changed the practice in neurorehab, as Dr. Lofredo said, is the competencies, but importantly, those competencies being shared for the outcome and the most effective outcome for our patients. So we are working in a multidisciplinary setup. We share our knowledge in our practice, the evidence-based practice, the image-related practice, the new technology-based evidence that is coming through, and goal direction or setting up the goals and working towards engaging the plasticity. But we do that all together. We share that in the clinical setup all together. So I think if there is any follow-up question on that, if not, then we can move to the second question from Mumbai. Any follow-up questions on that, please?
Thank you. And I think this approach that has been talked about and emphasized, the team approach, together, we call it together, everyone achieves more, has been really highlighted very well from the comments of all the speakers. And now we are moving on to the more specific questions, which will go more into the detail of some of the things that have been brought up by all the experts here. And we would like to first ask Professor Stephanie Clark, who is the president of WFNR. We have 2 questions for each of the panelists. And what we'd like to hear from you, madam, is that as the president of the WFNR, would you please describe your vision for a very inclusive neurorehabilitation which will include the entire world? What would be your vision to take us forward for neurorehabilitation in the world?
So, this is for you, Professor Clark.
Thank you very much for these very important questions. And indeed, I hope I can answer for really the WFNR as a whole. I think there are 3 points which will be extremely important, which are already important now. One is really that we establish and maintain the link between our clinical practice and the new advances in research. Several of my colleagues mentioned it in their opinion, what is important. And indeed, we are feeding our new developments, new technologies from basic research, applied research. And on the other hand, we need to use research to assess the results of what we are doing. Randomized controlled studies, meta-analysis. This would be the second point, the first point. The second point is that the neurorehabilitation needs to be interdisciplinary. We are so already, but we need to increase it and to gather together also with other professions so that we can really form a very competent team around our patients. This interdisciplinarity will need to go even further to patients' associations. And the third point I would like to mention is that we need to work really on an international level. And this is really the reason for the WFNR, that we can exchange between different countries. There are different competences in different countries, and we need to develop that. Neurorehabilitation will not be only one local enterprise in one country or a region, but it will be worldwide.
Thank you very much, Professor Clark. As we move towards this inclusive world in neurorehabilitation, it's very heartening to hear that the WFNR has this vision of even looking at models of care in developing country. And with that, I'll just go on to my next question for you, and that is, what does WFNR think its role will be in supporting developing countries to make their own new models of care as we begin our journey in neurorehabilitation? How would you support this?
Well, let me mention first what has been done from the beginning. First thing was to have active outreach to all countries, and countries in the developing world in particular. This was done through teaching initiatives, flying faculty, where we often worked with excellent colleagues locally to enhance the power in teaching and forming the younger generation of neurorehabilitation specialists. We are continuing to do it and adjusting to the ever-growing quality of our younger colleagues throughout the world. We are also helping to establish societies in developing countries. Where there are only few, we support specific initiatives. On the other hand, we encourage. There is some problem with the sound.
Can we have the other mic switched off at your end, please? There's a little bit of noise coming this end.
Yeah, all the mics are switched off over here.
Mic switched off on that end. Thank you.
Then what we are doing now is to promote the integration of members from the developing world in specific special interest groups. So they can contribute to the
I think, sorry, the mic has come on again on that side and we get a lot of background noise. Mumbai, can you turn this mics off that end?
All the mics are turned off at this end.